Hi everyone, it's Margaret Wallace-Duffy, and welcome to Insight on Eye Health. As a healthcare professional, I know firsthand the importance of our sight. It is truly a gift. So I hope you'll come on this journey with us as we take an integrative look at your eye health.
What an exciting day. Here we are in the middle of Peel Memorial Center for Integrative Health and Wellness. And we're filming Inside on Eye Health. I am privileged to be surrounding myself with healthcare providers who share my passion for education and linking arms to be able to empower patients to be well and stay well longer.
To help empower patients to maintain wellness, it is critical to see the opening of centers like Peel Memorial, facilitating the linking of healthcare providers and embracing a holistic approach to healthcare.
So we provide cataracts here. We do a very large number of cataracts for our community, as you can imagine, and that ties very closely with our seniors program as well. And of course, here at Peel, it is built as a state-of-the-art facility in that surgery no longer is required as an overnight stay. It's required as a day surgery, and so this facility provides the flexibility and the structure in order to support that, so that our patients can experience surgery in a very safe, flexible, as well as efficient way. So that's really, I think, a key thing for our geriatric patients.
With our aging population and patients living longer, we are seeing an increase in vision-threatening cataracts. A cataract is when the lens inside the eye becomes clouded, preventing light from entering into the eye and requiring surgical removal.
Cataract surgery, again, has become such a great procedure that the results have been quite amazing. And it's amazing how technology continues to push the envelope here. And in Canada, we're very blessed. I think any Canadian citizen has access to high-quality surgery with great outcomes without having to pay anything in terms of out-of-pocket. Our provincial insurance plans cover very good surgery and very good lenses. We also have the benefit of having refractive options, where we see sort of a combination of being able to remove the cataract and enhance one's vision beyond what a basic lens can provide. For example, enhancing vision at nighttime, what we call sort of aspheric optics, enhancing the optical clarity and the quality of vision beyond what a regular lens can provide. These are things that most governments have deemed to be something that's optional for patients. They're not necessary, but patients can choose to select those specialty lenses if they choose to pay out of pocket. We have testing that can be used to enhance the precision of surgery. And why is that helpful for certain patients? A patient may wish to, for example, reduce the need to wear glasses. They may wish to get out of glasses. Well, in order to do that, we need to be as precise as possible using a variety of different testing options to measure the eye, the front of the eye, the back of the eye, the length of the eye, the curvature of the eye, the optics of the eye, in order to pick the right lens implant, to size it right for their eye, so that they may be able to see without glasses for far away, for example, or even in some cases for far and near. So these are all extras, if you want to call them, or specialty devices or specialty tests that are not covered by the government, and probably for good reason, because I think every citizen should have the right to very good care. And if you wish to have further lifestyle benefits, whether it's reducing spectacles, reducing glasses or contact lenses, or treating astigmatism, for example, which is where the shape of your cornea may be shaped more like an oval than a round soccer ball, it's more like a football. We can fix those by using special lens implants that can enhance a patient's vision without glasses. So I think it's very important for patients to know their options. And there are a lot. It can get confusing. Taking the time with your eye care provider, both the optometrists have a great role and ophthalmology as well, to be able to counsel patients and educate patients. People are not only living longer, they're active longer. We see people that it's amazing how active our patients are. And I routinely operate on 80-year-old patients, and they're very active. I tell my patients that this is going to be a decision that's going to be there for the rest of your life. These lenses are going to last longer than you are. And so choose wisely. Choose something that's going to match your lifestyle. It's not a quick decision. It takes a lot of time to digest all this information, to talk about it again, and be aware of the choices. And I think we're very privileged to be in a time now where people have choices for lens upgrades and for testing options that really allow us to push the envelope.
Dealing with any type of vision loss can be hard on both the physical and mental well-being.
As we age, we know that we're going to be faced with many different challenges in terms of changes that our body is going to go through. And vision is certainly one of the areas we know typically we're all going to experience some form of vision loss as we get older. I recently saw a man who came to me for counseling. He had been diagnosed with an eye disease that was eventually going to lead to blindness. It was not a course that he knew could be predictable, and this was very difficult for him. There was a lot of uncertainty and a lot of unknowns, and for many people, the uncertainty is what causes a lot of anxiety. So for him, he began thinking about all the things he wouldn't be able to do, not being able to drive his motorcycle anymore, not being able to drive his car any longer, and really becoming very anxious and quite sad about the losses that he was fearful he was going to experience. In the work that we did, first we had to work through and allow him to talk about the loss, the sadness, the worries that he had. And over time, he was able to come to terms with recognizing that those fears he had hadn't happened yet, and he couldn't predict the future. And we worked on him being able to be more present in the moment. And some of the other strategies we looked at is how to incorporate mindfulness into his daily life. And he found that using some mindfulness meditations helped to reduce some of his anxiety, and that really helped him.
I was diagnosed with retinitis pigmentosa, short form is RP, about the age of 20, I would say. And I had vision tests done at that point in time. I was still able to drive at that time. And then when I was about 45, I was told my peripheral had deteriorated to the point where I wasn't able to drive anymore. So I lost my driving license. And so I live with low vision where I don't see above or kind of below this area or to the side. So it's kind of like a horse with blinders on. So a few years ago, I'd come in for my normal vision test with Dr. Teske, who was very well aware of my RP story. I came in and she says, your cataracts are developing quite quickly, probably due to the fact that I had retinitis pigmentosa. She told me that I might be a candidate for lens replacement therapy. So I went to the clinic in the TLC clinic in Mississauga, and I was told that I could have this procedure done for me, and then my vision, which was poor before, was now at 20/20. So what I do see is bang on, it's perfect, and it changed my life immensely. I was in a few weeks ago to see Dr. Teske for my annual eye exam, and she diagnosed me with dry eye, and I've been taking artificial tears to help rectify the dryness that I've been experiencing, and it's made my vision a lot more comfortable throughout the day.
Our environment and the stressful world that we live in can often lead to dry eye, which impacts our vision.
Dry eye is critical to address after procedures like cataract surgery or glaucoma treatment or extensive use of drops or some medications. So it's really critical to understand that if you're looking through a dirty window, if the vehicle in your car doesn't have a clear window, then you will not see well. When your cornea is dry or irritated, then of course the vision will not be crisp, and people discount the importance of that. It is critical to use gels, drops, ointments, and various foods and nutrition to make sure that your cornea is not dry. It is really important to be proactive, not reactive to dryness. By the time you feel that your eyes are dry, then it is already in a crisis. So it is really critical that we treat our eyes every day, much like you would treat lotion on your skin, on your hands, and on your face. Often when we talk about macular degeneration, we're addressing a seniors population, and it is certainly important for them to supplement their diet, but it's also more important or equally important for the caregivers and the children of those seniors to be supplementing their diet and preventing disease from ever happening.
When you look at macular degeneration, that too is a growing epidemic, and trying to prevent that disease is important through education. Why? Smoking is a big risk factor. Trying to encourage Canadians to stop smoking or not take up that bad habit will have a tremendous impact on the incidence of disease going forward. There's also a lot of talk in terms of trying to modify the diet. We know that a diet low in antioxidants has been linked to the incidence of the disease as well as progression of the disease. And so it's important to carry that discussion out with patients in a more holistic fashion. I like to think of the research endeavors now in three broad strokes. First off, earlier detection. So there's a lot of research being done in improving diagnostic tools to try and pick up disease at an earlier stage and be able to better monitor disease in a more effective manner. Earlier detection equals better outcomes. The second broad stroke I'd like to paint is that of treatment. We know that these diseases, diabetic retinopathy, macular degeneration, are multifactorial. They're very complex. They have many targets. And right now, while our drug therapy is excellent, the future holds better targets in terms of being more specific. The final, I think the most encouraging area of research is trying to do a deep dive in the understanding of the causes of disease, the risk factors that I alluded to earlier. They are multifactorial, but genetics does play a role in some of these diseases. We're still a far ways away from drug and genetic therapy in that regard, but trying to understand risk factors perhaps will allow upstream prevention intervention and hopefully avoid drug therapy altogether. I mean, that would be the ultimate goal.
We need to fuel our body with appropriate nutrients to maintain good health. We now understand that the status of microbial flora in the gut can be directly related to the risk of eye disease and your risk of cardiovascular disease, as stated in the past. The body is an entity.
Let's take a look at a quick and easy way to make salmon. Salmon has healthy omega-3s, so I would love for it to be part of your diet. Salmon, of course, tastes great on its own, but if you want to jazz it up a little, you just take a teaspoon of lemon juice, a teaspoon of grainy mustard, mix it together. You can add a teaspoon of maple syrup if you prefer a sweeter taste. You just spread it on the salmon. Then you just place it in a preheated 400-degree oven for 12 to 15 minutes. For this and other great recipes, please visit our virtual toolbox.
Our virtual toolbox will provide you with additional resources to empower you to maintain wellness. If we invest in our health, we have more options. So how do we prepare for that?
If you're not going into your retirement and into your older ages feeling solid in your health, and that's eyesight, which too many don't pay attention to, you're going to find that your declining years are going to find like they are declining years, and they shouldn't be. There's enough out there for us. There's enough other things we can buy, assistance we can get to get us through and actually enjoy our life at the quality we want. Longer living doesn't mean your quality has to go down necessarily, especially if you have the money to help out. So there's a lot of things that people don't understand till they're in the middle of it. And I want them to know up front, you need to be planning for that as part of your plan, but not just a piece of it. It should be front and foremost in your planning.
What an incredible change I have noticed over my 20 years of practice. The fastest growing demographic population online is seniors. I notice that every day in my practice. In fact, yesterday I had a patient specifically ask for computer glasses at 86 years of age. She uses the computer so much and she wants to dedicate a pair of glasses to the computer. We are a device-filled world, and blue light can be extremely harmful to the eyes. So specific coatings will protect your eyes from blue light, and it's important, particularly on computer glasses, that blue light coatings be used. As we age, the importance of good light and contrast is critical. When you get more light into the eye, then the vision is much clearer. At home, my children like to watch television in the dark, and as soon as I arrive, I turn every light on in the house, because even for me, the importance of light is critical, particularly in the case of seniors when there's more eye disease, with macular degeneration, with cataracts, with glaucoma. If there is low vision, then it is important to enhance the contrast. And if coatings will help do that, then that's critical for patients. When spectacle lenses are made, it is important to also be sure that there's an ultraviolet filter in that lens so that we can be protected from UV light, which of course accelerates eye disease.
Our vision is a valuable gift, and we often take it for granted until it's gone. That's why protecting your eyes is so important.
Sunglasses don't change our world, but they certainly change the way we see the world.
Protecting your eyes in sunlight. You know, UV exposure can be detrimental to the eye in many different ways, and wearing the right eye protection is also important as well. And that can be, again, something that's really worth discussing with your optometrist and eye care professional to be able to find the right protection for an individual person.
Eye diseases such as cataracts, macular degeneration, bumps, lumps, growths, cancers, all of those diseases are exacerbated with the presence of ultraviolet light. When I recommend a sunglass, it's always important to me to look at color, clarity, and detail. Once you wear good optics, you certainly won't want to wear anything else.
So glaucoma is a disease of the optic nerve, which basically resides in the back of the eye. It's an asymptomatic disease, meaning it's silent. Patients don't feel the problem, and typically related to high eye pressure in the eye. And that pressure can be slightly elevated and slowly damages the nerve fibers of the eye. Eventually, it causes loss of peripheral vision, and eventually, unfortunately, it can cause blindness. In Canada, glaucoma affects about 300,000 people that are known to have glaucoma. But stats have also showed that probably half the people who have glaucoma don't know they have it. So the true incidence of glaucoma is probably much higher. The biggest risk factor for glaucoma is aging. As we get older, our drainage channels in our eyes can decompensate and slowly the pressure can raise. But there are certain risk factors that make people at higher risk. So for example, patients with a family history, patients with African descent, patients who are diabetic, patients who have had multiple surgeries, for example. Comprehensive eye exam includes a number of different aspects. Obviously, taking a proper history, understanding family history and other risk factors are important to start off with. Assessing a patient's vision is a very basic point of entry as far as examining a patient's eye. What the right prescription they may need, making sure that they can see well far and near. And then the ever important examination into the eye. So we typically use a microscope and use special lighting systems to examine everything from the front to the back of the eye. And it gives us lots of clues, for example, whether there's any issues with regards to dry eye, any cataract issues that can cause blurring of vision, glaucoma, optic nerve problems, retinal diseases like diabetic retinopathy, diabetes in the eye, or macular degeneration are all things that can be visualized. That's the beauty of the eye, that we can visualize many issues that may happen before they actually become bigger problems. So unfortunately, glaucoma, it's not clear what causes glaucoma. So sometimes it's very hard to know how do we actually prevent it, but there are certain things that can be helpful. For example, smoking we know can be detrimental for not only glaucoma, but other eye diseases as well. So if one smokes, great to stop smoking amongst other health benefits. Fitness and lifestyle also play a role, and more evidence is growing that taking care of our bodies, physical fitness, cardiovascular fitness, keeping a good weight, these actually have been shown to actually keep pressures in the eye at a good level. And of course, avoiding extremes. Avoiding excessive alcohol intake, watching caffeine intake if it's excessive, things like that, probably play some role as far as protecting the eye in many ways. But ultimately, the most important aspect of our eye care is really, proper surveillance, proper monitoring by an eye care professional who knows what they're doing, who can examine the eye. There's yet no easy way to, prevent, and stop, many of the diseases from occurring. But early prevention by early detection is the most effective way to really prevent blindness or prevent serious visual loss.
Richard's vision has not been compromised to date due to preventative eye care and early diagnosis and treatment of glaucoma.
When I turned 40 in 2002, my wife suggested that I needed to go get an eye exam. And having a pilot's license and flying for many years, I didn't really think I needed one, but I went anyway. And sat down in Dr. Teske's chair, and she did an eye pressure measurement and just about fell off her chair. And she said, your pressures are about 29, and you need to go immediately to a specialist to see about that. I got onto eye drop medication, which I used once a day, one drop in each eye, and that reduced the eye pressures to a manageable level. Down the road a little ways, I was able to receive some eye surgery that opened a little bit more space in the back of the eye to allow the pressures to dissipate. And then I dropped under 20 in each eye, which was still high, but manageable. And more recently, through treatments and continuing visits to see Dr. Teske, I've been able to get it down to 16 in the afternoon and 12 in the mornings, which is outstanding, normal range. I don't feel that I'm at risk anymore for glaucoma. I do have a little bit of damage, but not enough to affect eyesight. I do use reading glasses now that I'm getting older, but other than that, I feel very happy and grateful that we got it early and have controlled it throughout the years. It was completely oblivious to the fact that I had really exceptionally high eye pressures. And by the time I did get checked, I was concerned that, well, is it already too late? So I'm very grateful for modern medical science. I mean, they've extended vision of people like me far into their lifetimes that might otherwise have been failing by now.
Patients often present for their eye exam without any symptoms of any problems. Often eye disease goes undetected because people feel like they can see well. It is really important for me to prevent disease rather than react to disease. And through the years, my toolbox has increased in terms of the available options with technology to be able to prevent disease. Recently, instead of documenting 15% of your retina, now we can document what 80% of the retina looks like. And that has been an amazing tool for us to be able to then refer to ophthalmology to be able to treat disease before vision is lost.
So this is the new piece of technology that we have in our office called an Optomap. So you're going to be looking through the opening of the piece of equipment, and what I'm going to have you look for is the blue light, and our goal is to have it turn to green, okay?
When we're performing this test, patients will not experience any discomfort. The test is quick, easy, accurate. So Optomap allows me not only to photo document the periphery of the retina where disease happens early, but allows me to educate the patient as to what I am seeing and what we will do to take action and prevent vision loss.
Diabetes and macular degeneration, both diseases, represent probably the most common cause of vision loss worldwide. Under the age of 55, diabetes is the #1 cause of vision loss, and above the age of 55, macular degeneration is the leading cause of vision loss. And what that translates to for Canadians is approximately over 1 million Canadians suffer from macular degeneration. And if you look at the entire population of Canada, we're estimating about 3 to 3.5 million Canadians suffer from diabetes. And of those, probably 500,000 have some form of manifestation of diabetic retinopathy.
And there are a number of eye complications from diabetes, including retinal complications as well as glaucoma and other causes as well. The issue in diabetes is typically related to the blood vessels in the eye. They become very fragile and they don't function normally. This can lead to dysfunction of the optic nerve as well as elevated pressures. Now, unfortunately, again, patients don't feel this problem. So it can happen very slowly, very insidiously, and over time can affect the patient's vision without them knowing it. So this is why it's very important. Patients with diabetes, patients who are over 40, that's not really old, but as we're getting a bit older, and patients with family history and other risk factors should be checked regularly by their eye care professional at least once a year.
The last time I was here, I was told that Dr. Teske had purchased new equipment, new technology that's called the Optomap, which gives you a really big, broad perspective of what the back of my retina looks like. I was never really able to fully understand what my eye was doing on the inside, but with the Optomap, I was able to fully understand why the progression of my retinitis pigmentosa was limiting my eyesight.
I've been a diabetic for many years now, but it's type 2 diabetes. I never was diabetic as a young person. Dr. Teske explained to me that the older way of testing the retina, they only saw a specific part of it. But now that this new tool, they can see the whole retina. Well, I think that if we had gone by the old method, I was fine. But when they put the new machine on, it showed the pinpoint spots where it needed to be lasered, which was, in my estimation, was fantastic, because otherwise I would have gone without it. And who knows, it might have been a while before anybody found the problem. I knit, I sew, I read. All these things I find I couldn't be able to do without my sight. So I would be practically helpless as far as I'm concerned. It would really make a difference to me.
People living with diabetes or other medical conditions are often required to take medications. Now, in order to take a holistic approach to our well-being, we need to make sure that we're safe. Oakville Trafalgar Memorial Hospital is the home of Origins Pharmacy, where Miranda Tawfik speaks about the importance of supplements.
I think we know now that our modern diet does not contain the nutrients that are necessary to fuel our bodies. So even our medications and chronic illness tend to deplete a lot of the nutrients that we have in our bodies. So supplements are essential to our overall optimal health. Hi.
So my doctor just diagnosed me with type 1 diabetes.
If we think about some of the issues associated with diabetes, we know that there's a lot of microvascular issues. We know that they're on a lot of medications and they have a lot of chronic illnesses. So that puts them all of a sudden at risk of nutrient depletion. High cholesterol, which can deplete coenzyme Q10, which are essential to every enzymatic reaction in the body. So especially with eye health and diabetes, I think sometimes we tend to neglect the eye because we're focused so much on their pain or their blood level sugars. Omega-3s and lutein is essential to loss of vision, dry eye, macular degeneration. All drops are not created equal. It depends on the company. It depends on the preservatives or the additive ingredients that they may have. Sometimes there are essential ingredients to, make sure that the pH is okay, but sometimes there might be preservatives that might cause some allergic reactions to some patients. So different forms of eye drops are important depending on who's using them. So if you want a more long-term effect, you would use an ointment. It stays on longer. It might cause a little bit more blurred vision, but there's more contact time, as opposed to a drop, which will help lubricate for several minutes, but again, can be used maybe more often and shorter intervals. So all stages of life should be consuming vitamins, from infants starting with vitamin D to when we age. And usually when we age, we tend to absorb less of the nutrients, maybe because of our digestive systems, maybe because of the medications and the chronic diseases. So everybody should be on vitamins.
Digestion is fundamental to our health, and maintaining good digestion takes work as we get older.
One of the biggest problems that face us today, no matter how old you are, is poor digestion. So especially as you age, your stomach acid levels, they decrease. And as we're stressed out, our guts become inflamed, unfortunately. And so one of the best ways to get around that and bypass the gut entirely is through intravenous infusion of vitamins and minerals. And we've found that to be a wonderfully effective way to kickstart the body's natural healing process and to get a good dose of antioxidants, which we know are so important for eye health, into the body quickly and safely. There are many herbs that we can use to decrease inflammation, whether it's curcumin. We actually find that ginkgo biloba, as popular as it is for cognition and memory, is wonderfully helpful to the eye, decreasing inflammation, increasing blood flow to the retina, and even protecting the optic nerve. So those are really important botanicals. However, if you're not getting that absorption, it's important to address it intravenously. Now, acupuncture is really, really exciting in that there's a meta-analysis, so a pooled scientific study of studies shows us that acupuncture can decrease symptoms of eye dryness alongside an optometrist care.
There are several coping mechanisms you can use if your vision becomes compromised.
I was asked to come in and see you at home because I understand your vision has been declining a little bit. There are many ways that occupational therapists can enable and empower older adults to continue to function at home and remain independent. Have appropriate lighting, for instance. Lighting is huge for any one of us, but with vision loss it's even more important. Using optical aids can be a big help for people who are in the earlier stages of vision loss, so things such as magnifying glasses or magnifiers with lights. Using high contrast, so for instance when they're having their meal, if they're having a white plate on a white mat, it may be difficult to see that plate, so putting the white plate on a darker mat. Using bright tape, it could be duct tape, it could be hockey tape on the edges of the staircase because depth perception may be affected with low vision. So that keeps them safe, prevents falls. So there's a whole variety of things. So I brought some options for you here to see. Other roles I have as an occupational therapist is to educate the client on the visual impairment they may have, so they're aware of what's happening now, what may happen in the future. I would also educate family members, and I would also connect clients and family members to various community resources such as the Canadian National Institute for the Blind, which can be for people with low vision as well as blindness, and other resources such as optometrists or ophthalmologists or eye care professionals that can also help the client.
Even though we're just eye care professionals, we're taking care of the human body. And so holistic medicine is something we're taught from day one in med school. And sometimes we lose sight of that, no pun intended, because we're focused so much on what's happening with the vision. But I'm convinced more and more, as I gain more times in practice, the importance of patients who take care of themselves. And I want to stress that to anyone who's thinking about taking care of their eyes in a better way.
Well, I hope you enjoyed the information we shared with you on eye health. Now, if you'd like to learn more and stay connected, be sure to visit us at our virtual toolbox. And of course, until next time, stay well.